So in the US, obviously, mistrust of science and medicine can lead to people skipping the flu shot, foregoing the measles vaccine for their children. That obviously has all sorts of negative consequences, both for the individual, but also for the broader population. So given all of that, can trust be rebuilt? And what can we do to do that? And that is what this whole forum is about, so I won't pretend to have any quick fixes, but I'd like to offer a few things for discussion. So I think trust depends fundamentally on answering these three questions. So do you know what you're doing? And that is a question of competence. The second is, will you tell me what you're doing? That is a question of transparency. And the third is, are you doing it to help me, or are you doing it to help yourself? And that final one is a question of motive. So I think we can start to rebuild trust by using strategies that try to answer these three questions for patients. So the first part of this, I think, is using clear and transparent communication, so taking the extra time to make sure that patients know what is happening, what they can expect going forward, explaining the intricacies of treatments, having a sense that you're coming to that decision together. The second point might sound obvious, but I do think that a history of fulfilled trust is probably the best predictor in people's mind about whether their trust can be expected to be fulfilled in the future. So if you say that you're going to call a patient at a certain time, making sure that you call them. If you say on morning rounds, you'll swing back around in the afternoon to continue your conversation. Doing those types of small things can, I think, at least get us on the path to creating trust. The third point is, as with any relationship, creating the expectation for a long-term relationship through repeated interactions can help build trust. And I think this part can help us capitalize on that paradox of trust, where people do trust and they are satisfied with the care that they receive. So the more that we can have individual patients interacting, I think, with the same doctor, the same nurse, the same care manager, that can potentially be effective. The fourth issue here is around promoting shared interests and minimizing power differences. So there's obviously inherently a large information asymmetry and knowledge asymmetry between patients and doctors. And when that grows too large, it becomes a relationship of dependency as opposed to a relationship that's built on trust. And so trying to minimize those power differences, I think, is another useful thing to think about. Fifth is disclosing conflicts of interest that gets at questions of transparency and of motive. Sixth is this idea of community-based participatory research. And the idea is that many patients have traditionally been wary of both the methods and the motives of clinical research, and giving patients greater say, going to communities, going to patients, giving them greater say in the design, in the goals, and the dissemination of research. It can help ease this sense that research is being conducted on them as opposed to with them. So CBPR has been proposed as another strategy. And finally, governments and institutions should consider identifying and using trusted spokespeople in moments of crisis. So as we've heard before, the messenger often does actually matter. In disease outbreaks that are caused by bioterrorism, Americans are much more likely to trust information that's coming from the CDC as compared to the FBI or the Department of Health and Human Services. So the more that we can identify those trusted spokespeople and use them, that's another way we can be effective. And I'll conclude by saying that all institutions and all providers are of course imperfect, and a degree of skepticism is healthy, a degree of skepticism is important. America was in some ways founded on skepticism of power and authority. We have separation of powers and checks and balances and relatively limited government. But in recent years, the pendulum might have swung too far. And when distrust becomes pervasive, it can erode the glue that holds us together and can inhibit our ability to keep people healthy.